Our breaking news this afternoon is regarding attention deficit hyperactivity disorder. This mental disorder has caused a social stigma around society, and people can have negative stereotypes towards those diagnosed with ADHD. Stay tuned to find out how ADHD and this stigma affect the lives of children and adults, and how any problems they face can carry on throughout their lives to adulthood. Good afternoon, my name is Singh, and welcome to the 4 o'clock news hour here in the nation's capital. Attention deficit hyperactivity disorder, also known as ADHD, is a disorder that has seen a rise in prevalence in recent years, specifically in how often it is being diagnosed. A diagnosis identifies the nature of a problem or illness based on the symptoms someone might have. In a study performed by experimenters at Epic Research, who analyzed data from 3,389,383 ADHD patients, found the presence of ADHD in their population had tripled since 2010. The data displayed that 0.19% of participants had their initial diagnosis in 2010, while 0.57% had their initial diagnosis in 2022. The highest increase the investigators saw was between 2020 and 2022. The data indicates that ADHD diagnoses have increased in general and have significantly soared in recent years. Now, there has been a stigma regarding ADHD, and I set out to clarify the stereotypes most people have regarding ADHD and interviewed 3 doctors, experts in this field, on their opinions regarding this issue, what ADHD is in the first place, and why it should be taken seriously. Good afternoon, Dr. Gardner, Dr. Singh, and Dr. Lopez. Thank you for making the time to come here today and giving us knowledge about a prevalent topic.
Good afternoon. Thank you for having us here.
Could you first give us a brief background on what ADHD is and what are some of the effects of it on those with the disorder?
Sure. So, attention deficit hyperactivity disorder is a common neurodevelopmental disorder generally diagnosed during the formative years. However, many young adults and adults alike have ADHD and lack proper treatment due to delayed diagnosis. Internalizing problems could include symptoms like sadness, anxiety, and loneliness. Adolescence is a crucial period for developing one's identity and can be difficult to navigate. ADHD aggravates this issue. Sitting still and staying focused can be challenging, internalizing specific emotions. These social challenges can lead to the development of anxiety and depression. Therefore, the specific age of diagnosis can be an essential factor for these symptoms that can develop because of ADHD. The stigma surrounding receiving an ADHD diagnosis must be put at rest, especially among young adults attempting to navigate the world around them. Delayed ADHD diagnosis can hinder a child's progression throughout adolescence.
This neurodevelopmental disorder can impact both toddlers and adults. A persistent inattention, hyperactivity, and impulsivity pattern can affect everyday functioning, academic or occupational performance, and interpersonal interactions are the cornerstone of ADHD. Following a thorough evaluation, mental health specialists or pediatricians frequently diagnose ADHD. Behavioral therapy, medication, such as stimulants or non-stimulants, and educational support are commonly used as treatment alternatives. Helping people with ADHD manage their symptoms and enhancing their quality of life is the aim of treatment. It's crucial to remember that ADHD is an actual medical condition, and that with the correct diagnosis and treatment, people with ADHD may live happy, successful lives. There are many complications and social challenges that arise during someone's adolescence. Adolescence is the stage in the life cycle during which youth may explore multiple ways of thinking and living and are highly influenced by peers. This can lead to young adults struggling to be themselves and acting as their own personalities. Younger adults with learning disabilities struggle to control their emotions, which can cause them to be punished for how they behave at home or in the classroom setting. These sorts of actions may limit the person's social life, since many individuals are unlikely to become friends with a troublemaker. A low sense of social belonging and a history of exclusionary discipline during high school has been found to predict internalizing symptomology in adolescence.
So you mentioned the idea of internalizing symptomatology. Can you go into this concept more and explain how this affects adolescents with ADHD?
Of course. So we went over the idea that adolescents with ADHD may struggle to fit in socially, as their impulsivity and hyperactivity can make it tough to follow social norms and maintain friendships. People with ADHD may not express their emotions of how they feel with their family and others, and will simply internalize them, meaning that they don't say them openly. This social isolation can lead to feelings of loneliness and depression. Adolescents with ADHD might also have trouble finishing generally simple tasks for others, adding to the challenges they face in the classroom and problems in their social life. These continual failures can undermine their sense of self-worth and self-esteem, leaving them feeling inadequacy and self-doubt, especially if adolescents are unaware of their diagnosis. Internalizing ADHD can result in a destructive mental conversation in which people constantly criticize themselves for their alleged failings. Instead of seeing their struggles as signs of a physical problem, and they would become aware of these signs if diagnosed, they could just see them as a personal shortcoming. Adolescents with ADHD may feel helpless when facing issues over time. They can think that they have no power to influence or alter their situation, which might make them feel hopeless.
Wow, I did not know that people with ADHD could encounter such challenges. It has made me more aware of aspects I might have not considered seriously before. Dr. Singh, could you tell us what goes on in the brain that may be the reason such symptoms are caused?
One of the primary differences between a brain affected by ADHD and a brain that is not is the level of the neurotransmitter norepinephrine. According to the Attention Deficit Disorder Association, low levels of the neurotransmitters dopamine and norepinephrine are linked with ADHD. An imbalance in the transmission of neurotransmitters is generally associated with the symptoms of ADHD, including impulsivity and a lack of attention. A brain affected by ADHD will also perceive pleasure and reward differently, since the dopamine reward pathway is altered. ADHD mainly affects the frontal cortex, which regulates emotion, behavior, and attention, as well as the limbic system, which influences one's motivation. ADHD can contribute to a lack of awareness, hyperactivity, and poor decision-making. Lastly, ADHD impacts the basal ganglia, responsible for motor learning. For this reason, individuals suffering from ADHD tend to struggle with regulating their emotions, planning, and multitasking. The most significant difference between an ADHD brain and a non-ADHD brain is that ADHD causes the default mode network, the network that causes one to daydream and lose focus, to be worsened, and causes the brain to go into overdrive.
Thank you for the biological explanation of ADHD, Dr. Singh. Considering what we have discussed so far, Dr. Lopez, could you clarify the importance of getting diagnosed with ADHD?
Attention deficit hyperactivity disorder, diagnosis, and treatment are crucial for several reasons, and they can benefit those affected by the disorder. For example, a formal diagnosis aids patients, their families, and healthcare professionals in understanding the particular difficulties related to ADHD. It offers clarification and lessens the stigma frequently connected to the disease. Also, anxiety and depression are two more mental health problems often accompanying ADHD. These conditions can be avoided or have their severity reduced by correctly diagnosing and treating ADHD.
Through the proper treatment, patients can reduce their feelings of loneliness and will have a trusted individual, the doctor, to express their emotions to preventing internalizing symptoms. Overall, taking care of ADHD in children can have long-term advantages since it can result in better academic and professional outcomes, a lower chance of substance reliance, and better mental health throughout a person's life.
Alright, thank you, Dr. Lopez. So a bit earlier, Dr. Gardner, you mentioned some of the treatments those diagnosed with ADHD can receive. Could you explain those in a bit more detail?
Yes, I can. A diagnosis is frequently required to access the best treatment options. Medications, behavioral therapy, and other therapies can dramatically improve the quality of life for those with ADHD. Behavioral therapy is a form of psychotherapy or psychological care that focuses on recognizing and changing unhelpful or unwanted patterns of behavior and thoughts. ADHD treatment plans frequently include the prescription of medications. The primary signs and symptoms of ADHD, such as inability to pay attention, hyperactivity, and impulsivity, can be controlled by the aid of drugs, such as Adderall. Lastly, relaxation therapy teaches people how to relax both physically and mentally. Relaxation therapy is a therapeutic strategy that focuses on assisting people in reducing stress, anxiety, and tension. In both the short and long term, the main objective of relaxation therapy is to foster a sense of well-being and peace.
Ah, I see. Thank you. And Dr. Singh, could you explain how medication can be a treatment alternative?
The pharmaceutical drug Adderall is frequently used to treat ADHD. Amphetamine and dextroamphetamine are the main active components of the central nervous system stimulant. The primary goal of using Adderall for ADHD is to treat the main symptoms of the condition, which include inattention, hyperactivity, and impulsivity. Dopamine and norepinephrine are two neurotransmitters that Adderall raises in the brain's receptors. These neurotransmitters help to manage impulse control, focus, and attention. It's crucial to remember that Adderall is frequently a component of a thorough treatment program for ADHD, which may also include behavioral therapy, counseling, and assistance for education. Only a skilled healthcare professional should provide Adderall, and dosage adjustments should be carefully based on the patient's response and tolerance.
Thank you for clarifying. I appreciate all of you for taking time out of your busy schedule to join me here today. Thank you for your valuable insights.
The pleasure is all ours.
In wrapping up my conversation with the physicians, I found that ADHD is a complex disorder and cannot be oversimplified through common stereotypes like a lack of focus or hyperactivity. Understanding its complexity is crucial. People should not be afraid of being diagnosed with ADHD, as there are multiple treatment options. However, avoiding being diagnosed could lead to hurdles in your future life. Adults can miss deadlines or forget meetings and feel out of place in a workplace environment. Early recognition is vital to having a simpler life. So if you are in your teens, 20s, or even older, don't run away from a diagnosis. If you have any questions about ADHD, please contact the National Alliance on Mental Illness or the NAMI helpline at 1-800-950-6264 or email info@nami.org. Thank you for watching today's broadcast. I hope you enjoy the rest of your day.